Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I wanted to show off this amazing case, and I wanted to show it off first of all because Javon is one of my favorite patients, and we truly enjoyed getting to know Javon throughout his treatment. You know, the best part about what we do in orthodontics is that we get to help people feel better about their smile. We get to help people feel more confident about who they are. And we really got to do that with Javon. And along the way, we got to know him really well and just what a great guy he is and just build those relationships. And that's my favorite part about being an orthodontist is just trying to make a positive impact in people's lives and you know, being a small influence and trying to brighten their day each and every visit. So Javon came to us looking for a better smile, and this is a close-up of his teeth when we started. You can tell that teeth are crowded. One of the things that we really wanted to fix bite-wise was that this lower canine tooth was to the outside of the upper teeth, so it's like an underbite with this one tooth, and that doesn't really let Javon's jaws function the way that they're supposed to function. So we wanted to take care of that. Here's a look at the lower crowding, and this is an exceptionally crowded lower arch. You can see that there's almost no space for that lower right canine to fit in there. These two teeth are just about touching, and so we're a whole tooth shy of space on the lower right hand side, and we also have some crowding in the lower left hand side. When things are this crowded, there really isn't a good option beyond taking out teeth, and so we took out two teeth on Javon to try to make space. And here's a picture of kind of where we were in progress of closing the space. You can see that there are some spaces right here, and that's where the teeth were extracted. We've utilized the spaces that were created by extracting those teeth to unravel all of the crowding of these lower front teeth. So if you go back and you look at where we had these crowded lower front teeth, and all that crowding has been resolved now after we took out the premolars. So here we are in the process of closing space. Now, when we take out two lower teeth, oftentimes we will also take out two upper teeth. The upper arch was not quite as crowded as the lower arch, but we did elect to take out the two premolars on the bottom and on the top so that the bite can stay balanced and fit together properly. So here we are in progress of closing upper spaces. You can see that right here and right here are where we took out the premolars. We've utilized the space that was created from the extraction to straighten the upper front teeth, and now we're in process of closing the spaces. Here's where we got to with those upper teeth. Really beautiful results. Everything is totally straight. I used a bonded retainer for these front teeth just because of how irregular they were when we started. Really wanted to make sure that they stayed in place. Here's where we got to on the lower arch. Again, the irregularity of those lower front teeth really necessitated having a bonded lingual retainer to hold these front six teeth. And then Javon wears removable retainers on top of all this because there were some changes in the back of the mouth as well. Here's where we got to on the center photo. You can see that those lower front teeth are all now tucked inside of the upper front teeth, and this is just a beautiful result. Here's Javon smiling at the end of treatment, and I love his smile. I love how those upper front teeth follow the curvature of his lower lip. We call that smile arc, and so I think this is a really great aesthetic result for Javon as well. Just as you can see where we started and where we finished, these are the lower front teeth. Very crowded when we started, perfectly straight at the finish. These are the upper front teeth, pretty crowded when we started, perfectly straight when we finished. Notice that the upper arch is now wider than what it was previously. And then here's our comparison of the kind of what we call the center photo. Again, you can see a really great occlusion or a really great bite here with the teeth coming together at the end like they should. And here's the difference from Javon smiling at the start to him smiling at the end. Obviously a bigger smile at the end because he's feeling more confident about his smile, and we love that about what we were able to do for Javon. And then just going back to what it's all about, you know, making a difference in people's lives. And I'm so glad that I got to be a part of this man's life. I think he's an incredible guy. And Javon, we truly enjoyed your presence in our office. We hope that we were able to make your life a little bit better, and we know that we were able to make you more confident in smiling big. So go show off that big smile, show off that big personality that you got. We love you, Javon. Take care.